Hello everyone, my name is Naunihal Singh. I'm a first year internal medicine resident at NYU Langone Long Island Hospital, and today I will be discussing an important topic, which is vaccination as a preventative measure for hepatitis B and liver disease. Why is this an important topic? If you have liver disease, you're at an increased risk of severe liver injury from hepatitis B virus. According to the CDC, people with cirrhosis, steatotic liver, alcoholic liver, history of IV drug use, or anyone working in healthcare related fields are at an increased risk. What is hepatitis B and how is it transmitted? Hep B is a double-stranded DNA virus that binds to DNA of our liver cells, which can lead to chronic inflammation, fibrosis, and cancer. It spreads through body fluid contacts, things such as use of infected needles, IV drug use, unsterilized piercing or tattoo equipment, unprotected sex, rare cases with blood transfusions, and simple things such as even sharing personal hygiene items like a razor. What can you do to prevent this? Best protection is vaccination. I would like to discuss two different options. The first one would be the Hepatitis B vaccine, which is a 2-dose vaccination. First dose is administered at the initial visit, and the second one is at 1 month time frame. This has shown to induce a stronger and longer lasting immunity than the traditional 3-dose vaccination, especially in people with liver disease and diabetes. There's a QR code on the poster, and if you scan that QR code, it will take you directly to the link where you can see if there's a pharmacy near you that can give you this vaccination. The second, the traditional 3-dose vaccination, is the Ingrix B vaccine. This is given at the initial visit, 1 month, and then at a 6-month time frame. Another high-risk population that I would like to talk about is to how do we reduce the perinatal risk in pregnant patients whose Hep V viral load is more than 200,000 at the third trimester. They're recommended to start antiviral therapy with tenofovir, and at birth, if the mothers are hepatitis surface antigen B positive, the infant should receive the Hep B vaccine series along with the hepatitis B immune globulin within 12 hours of birth as well. And why are we talking about this topic? Why is this important? Well, hepatitis B carriers are 100 times more likely to develop liver cancer. And out of close to 300 million people who live with chronic hepatitis B, more than 800,000 die annually due to Hep B-related liver disease. And how much of an importance can vaccinations make? What can we learn from our past vaccination success? A great example is Taiwan's vaccination campaign in the 80s. A push was made to vaccinate individuals that were at higher risk, and what they saw was amazing. They saw a reduced mother-to-child transmission rate, lowered hepatitis B virus prevalence, went down from close to 10% to 1% in 25 years, and a significant drop in liver cancer cases as well. And what other small steps that you can do in daily lives to prevent this? The first one would be to avoid sharing needles. Second is use of protection during sexual activity. Just to wrap this all up, hepatitis B is a serious but preventable disease, and vaccination is the best way you can protect yourself and others. Thank you.